Do you have a red or an itchy eye? You could probably be having conjunctivitis. People often call conjunctivitis as pink eye because it can cause the white of the eye to take on a pink or red color. It is an inflammation of the conjunctiva. The conjunctiva is the thin clear tissue that lies over the white part of the eye and lines the inside of the eyelid. Symptoms of pink eye can vary but typically include redness or swelling of the white of the eye. Children get it a lot. It can be highly contagious. It spreads rapidly in schools and daycare centers, but it's rarely serious. In this video, we will have a look at the causes, symptoms, how it is transferred, how to prevent its spread, and its treatment. Let us know what causes the eye to turn red. The most common causes are viruses, bacteria, and allergens. Viral conjunctivitis. It is infection of the eye caused by a virus. It can be caused by a number of different viruses, such as adenoviruses. It is very contagious. Sometimes it can result in large spread depending on the virus. The other is bacterial conjunctivitis. If the infection of the eye caused by certain bacteria, it is referred as bacterial conjunctivitis. It can be caused by bacteria such as Staphylococcus aureus, Streptococcus pneumoniae, Haemophilus influenza, Moraxella catarrhalis, or, less commonly, Chlamydia trachomatis and Neisseria gonorrhoeae. It can be spread easily, especially with certain bacteria and in certain settings. Children with conjunctivitis, without fever or behavioral changes, can usually continue going to school. It is more common in kids than adults, and is observed more frequently in December through April. The most common type is allergic conjunctivitis. It is a result of the body's reaction to allergens, such as pollen from trees, plants, grasses, and weeds, dust mites, molds, dander from pets, medicines, or cosmetics. It is not contagious. It occurs more frequently among people with other allergic conditions, such as hay fever, asthma, and eczema. It can occur seasonally, when allergens such as pollen counts are high. Or can also occur year-round due to indoor allergens, such as dust mites and animal dander. One more is conjunctivitis, caused by irritants. It is due to irritation from a foreign body in the eye or contact with smoke, dust, fumes, or chemicals. It is not contagious. It can occur when contact lenses are worn longer than recommended or not cleaned properly. Now let's look at the symptoms of conjunctivitis. How do you identify you have conjunctivitis? First and foremost, you have pink or red color in the white of the eye. Swelling of the conjunctiva, which is the thin layer that lines the white part of the eye and the inside of the eyelid. Increased tear production. Feeling like a foreign body is in the eye or an urge to rub the eye. Itching, irritation, and/or burning. Discharge, pus or mucus. Crusting of eyelids or lashes, especially in the morning. Contact lenses that feel uncomfortable and/or do not stay in place on the eye. However, depending on the cause, other symptoms may occur. For viral conjunctivitis, it can occur with symptoms of a cold, flu, or other respiratory infection. It usually begins in one eye and may spread to the other eye within days. Discharge from the eye is usually watery rather than thick. If you have bacterial conjunctivitis, then it is more commonly associated with discharge pus, which can lead to eyelids sticking together. Sometimes it occurs with an ear infection. If you have allergic conjunctivitis, then usually occurs in both eyes. It can produce intense itching, tearing, and swelling in the eyes. May occur with symptoms of allergies, such as an itchy nose, sneezing, a scratchy throat, or asthma. When conjunctivitis is caused by irritants, then it can produce watery eyes and mucus discharge. Now let's look at the transmission of conjunctivitis. How it spreads from person to person. Several viruses and bacteria can cause pink eye, some of which are very contagious. They usually spread from an infected person to others through close personal contact, such as touching or shaking hands. Through air, by coughing and sneezing. And also by touching an object or surface with germs on it, then touching your eyes, before washing your hands. Preventing the spread of conjunctivitis. You can greatly reduce the risk of getting conjunctivitis or spreading it to someone else by following some simple steps for good hygiene. Wash your hands often with soap and warm water for at least 20 seconds. Wash them especially well before and after cleaning, or applying eye drops or ointment to your infected eye. Avoid touching or rubbing your eyes. This can worsen the condition or spread it to your other eye. With clean hands, wash any discharge from around your eye several times a day using a clean, wet washcloth or fresh cotton ball. Do not use the same eye drop dispenser or bottle for your infected and non-infected eyes. Wash pillowcases, sheets, washcloths, and towels often in hot water and detergent. Wash your hands after handling such items. Stop wearing contact lenses until your eye doctor says it's okay to start wearing them again. Clean eyeglasses, being careful not to contaminate items, like hand towels, that might be shared by other people. Clean, store, and replace your contact lenses as instructed by your eye doctor. Do not share personal items, such as pillows, washcloths, towels, eye drops, eye or face makeup, makeup brushes, contact lenses, contact lens storage cases, or eyeglasses. Do not use swimming pools. These steps can greatly reduce the spread of infection. However, care should be taken to avoid getting sick again. If you have had conjunctivitis, there are steps you can take to avoid reinfection once the infection goes away. Throw away and replace any eye or face makeup or makeup brushes you used while infected. Throw away disposable contact lenses and cases that you used while your eyes were infected. Throw away contact lens solutions that you used while your eyes were infected. Clean extended wear lenses as directed. Clean eyeglasses and cases that you used while infected. Now, let's look at the treatment of conjunctivitis. There are times when it is important to seek medical care for conjunctivitis, pink eye. However, this is not always necessary. When you need to seek medical care, you should see a healthcare provider if you have conjunctivitis along with any of the following. Pain in the eyes. If you have sensitivity to light or blurred vision that does not improve when discharge is wiped from the eyes. Intense redness in the eyes. Symptoms that get worse or don't improve, including pink eye thought to be caused by bacteria which does not improve after 24 hours of antibiotic use. A weakened immune system, for example, from HIV infection, cancer treatment, or other medical conditions or treatments. All of the individuals experiencing these symptoms should consult the doctor. Newborns with symptoms of conjunctivitis should be seen by a doctor right away.